Hello and welcome to this talk on carpal tunnel syndrome in the specialist area of general practice. So first we're going to have a little look at what you already know. So the first question, the median nerve passes through the carpal tunnel to innervate the hand. Which of these muscles does it supply? So you have four options here, and there's a little hint in the corner for you guys if you need some help. I'll give you a few seconds to think of an answer. Okay, so the answer to this question is the thenar muscles. So the thenar muscles is this bulk of muscles found at the base of the thumb, made up of the flexor pollicis brevis, the abductor pollicis brevis, and the opponens pollicis. Now these are all very important in flexion of the thumb, and this is associated with grip. Here's another question for you. What is a risk factor for developing carpal tunnel syndrome? So there's four more options for you there. And another hint. Okay, so the answer to this question is obesity. This is because obesity is going to cause increased pressure within the area, which is going to increase the chance of compressing the nerve and causing symptoms. So here's the final question for you. Which clinical sign does not suggest carpal tunnel syndrome? So there's four options for you. So three of them are used in a clinical exam. One of them is not for carpal tunnel syndrome. Okay. So the answer to this is Cozen's test. This is actually used to look for lateral epicondylitis, also known as tennis elbow. So the other three are all used to look for CTS. I'll be discussing these later in the talk. So this is what we're going to talk about today. So we've gone through the introduction. We're going to be discussing what carpal tunnel syndrome is, the symptoms and history, investigations and differential diagnosis, management within the community, and look at the clinical exam and any tips for the OSCE. At the end, we'll be reintroducing the questions we went through to see what you've learned. So we'll start with asking ourselves, what is carpal tunnel syndrome? So this is a syndrome where you're going to present with hand symptoms due to compression of the median nerve within the carpal tunnel. It's very commonly found, especially in the GP, and is the most common nerve compression syndrome. So there are various conditions that can cause CTS. For examples for you here, you've got obesity, as we've mentioned before, hypothyroidism, rheumatoid arthritis, and pregnancy. So these are all going to increase the risk of compression of this median nerve with the transverse carpal ligament overlying it. So this ligament is what causes the roof of the carpal tunnel, the rest formed by some of the bones of the hand. So there's various symptoms that you can get with carpal tunnel syndrome. Classically, you're going to get pain, numbness, and tingling within the distribution of the median nerve. This diagram presents this quite well. So you can see it can affect the thumb, index finger, middle, and lateral side of the ring finger. So these are all areas innervated by the median nerve. It's typically found on one side, and onset of symptoms will come on quite gradually. It's worse at night, and there can be poor grip strength associated with it. This is I mentioned before, the thenar muscles, which are helpful with grip, and these are innervated by the median nerve, and if this is becoming compressed, then you can get problems with grip. Pain can also extend further up the arm, and you may also get atrophy of the thenar eminence, so it might show as wasting. So in a history, there's various questions that you could be asked of the patient to develop a thorough history. So you'd like to ask about their occupation, because there's certain occupations that can make CTS worse. So people who use keyboards a lot get a lot of pressure on their wrists on the side of a table, and also people who use vibrating tools, so builders. We're going to ask about any nocturnal symptoms, any problems with grip strength as previously mentioned. So they might mention any dropping their keys, dropping things regularly, any difficulty writing, holding a pen. Any other conditions that they might have which can make CTS worse or point towards a diagnosis of it. You want to look for signs for any other pathology, so any neck pain or any other neurological problems. So investigations and referrals. CTS is typically a clinical diagnosis. You'd make it just based on the history and exam alone. Imaging is not often needed and isn't very useful. Other tests which could be done can be done by a surgeon or a neurologist, which can be referred to. Electrodiagnostic referral may also be helpful if you're unsure whether the median nerve is the one being affected. So a key differential diagnosis to consider when thinking of CTS is cervical radiculopathy. So this is caused by compression of the nerves further up within the neck. So this can cause similar problems as seen in this picture. So C5 through to C8 can be affected. So management within the community. There's various things that can be done. One thing that can be started with is optimizing the treatment for any conditions that they've got, which might be exacerbating CTS. So as we mentioned, RA is one of them. Obviously lifestyle modifications, which you'll get as first line thinking for any GP condition. So this can be avoiding any repetitive movement that's straining the median nerve. Physiotherapy may be of help, and some patients may benefit from injection of steroids to the area or taking it more systemically in the form of an oral tablet. Splinting of the wrist can help to immobilize the area and prevent any extra pressure on the median nerve. So this can be done at night time and during any compression-inducing activity. If the condition is more severe for the patient, then surgery may be helpful to cut the transverse carpal ligament and release some of the pressure in the area. These patients can require monthly follow-up, and safety netting should always be considered, and this can be done by advising the patient to return if the symptoms worsen or any new features develop. So on the exam, as mentioned before, there are some tests that you can do to look for CTS in particular. So all of these tests are going to elicit the symptoms and make it worse by compressing the median nerve. So a very common one that's done is Fallon's test. So as you can see in this picture here, the wrist is gently flexed and held at the end of its range of movement. And this causes compression within the median nerve. And within 60 seconds, you'll see the symptoms start to show themselves. The faster that they come on, the more advanced the syndrome is. Another test is Durkin's test, which is a carpal compression test, where firm pressure is applied over the nerve and symptoms may be seen within 30 seconds. Another test that's done is Tinnell's test. We can have light tapping over the flexor retinaculum to produce the symptoms. Now here's some tips for the OSCE. What's very helpful to do is have knowledge of hand innervation. So knowing the different areas that are innervated by the median, radial and ulnar nerves, and being aware of the different muscles within these areas and any associated symptoms that may be related to them. In the history, it's also very helpful to show that you're thinking of differential diagnoses. So as I mentioned before, cervical radiculopathy. So you can show the examiner you're thinking of this by asking the patient if they're having any neck or upper arm symptoms. It's also very helpful to think of any factors that may be exacerbating the condition within the patient's lifestyle. So asking about things like occupation can show that you're thinking about this. It's helpful to be confident about any sensory and motor exams and being aware of at least one of the clinical tests that can help to look for CTS. This shows that you're thinking about what the condition could be and showing a more thorough examination. It may also be helpful to explain to the patient why you're doing certain things or asking certain questions. And this can show both the patient and the examiner that you've got a good thought process in breaking down why it could be CTS and having some investigative thinking. Okay, so we're going to reintroduce those questions we had at the beginning to see what you've learned. So there's the first question for you, and these are the 4 muscles. And the answer to this is the thenar muscles. And there's the second question again for you. So which of these is the risk factor for developing carpal tunnel syndrome? So anything that's going to exacerbate the nerve and cause symptoms. So this will be obesity. And the final question, which of these clinical signs does not suggest carpal tunnel syndrome? And the answer to this one is Cosen's test. This is for lateral epicondylitis. So thank you very much for listening. I hope this was helpful. I've given you guys a link at the end to the nice guidance for CTS, which has some very helpful hints and tips. Thank you for listening.